What are the top 7 mistakes I see people make when starting their first Medicare plan? Hi, my name is Mike Lovell, founder of AskMedicareMike.com. Been licensed since 2009, and I've seen a lot in that time frame. So let's get right to it. The first one that I see people making when starting their Medicare is not checking the networks for their plans. This could be for prescription drugs or their Advantage plans. There's pharmacies that are in network or out of network, which means you can't use that plan at that pharmacy. Also, there's plans that have preferred pharmacies, so you'll get better pricing there, lowering your costs at those specific pharmacies. It's important to know ahead of time. Advantage plans, even more important to check the network because there's doctors and hospitals that are in the network that you may or may not be able to see if they're not in network then. Crucial to know. Number 2, not picking up a drug plan because you're healthy and not taking any prescriptions. I see this every week, unfortunately. People been on Medicare for a little while and didn't take out a drug plan because they weren't taking any prescriptions. A couple of years goes by, get a new prescription for a more expensive medication. You want to start a drug plan, and it's expensive because you have a late enrollment penalty because you didn't have prescription drug coverage. Also, there's hoops to jump through. You can only start these plans at certain times of the year. Now, number 3, sticking with prescriptions, not checking to see if your prescription's covered by that plan. Fortunately, sometimes we just enroll in a plan based off of the name of the company or a recommendation. We don't actually check the prescriptions. You come to find out your prescription is not covered, or it's covered really expensive. It's common with brands or even creams, even generic creams, kind of unique there. Number 4, listening only to friends and family. Obviously, good idea to bounce ideas off people who've been there, get some advice. But you got to ask yourself, did they do their research when they started their plan? Do they see the same doctors in the hospitals as you? Are they taking the exact same medications? If they're not, they might have some different priorities, different things covered than you do. So it's good to get their advice, but don't use them as the sole resource. So who do you talk to? Obviously, a licensed agent is a good thing. This is number 5. But it's important to know when looking for help, a captive versus an independent agent. Most people only talk to one agent. And if you're talking to a captive agent, which means they only work with one company, you're really limiting yourself as far as what your options out there are. It can sound like a great deal, but you don't have anything to compare it to, so you don't really know. Where an independent agent can help you shop the market from a bunch of different companies, especially with supplements where they're standardized. The big difference is the price that you pay for it, but the coverage is all the same. You don't want to overpay for that. Number 6, picking a plan for the extra benefits. If you turn on the TV during the fall, you see those commercials, Medicare all-in-one plan, $0. Joe Namath is on there talking about the dental vision hearing. Well, those plans are a good option for a lot of people, but the extra benefits, I think, are a secondary consideration versus the primary reason you're getting Medicare is for your health coverage. Now, if you pick out the plan and there's some extra bonus perks in there, such as the dental and vision, great. But don't make that be the primary reason why you're picking a plan. 7, last option, or last big thing on why people make a mistake I see is listening to non-licensed people such as volunteers. Again, good to get their advice, but ask them, what's their experience? How have they been trained? Do they have any special qualifications? How long have they been doing this? And also, what happens if they give you poor advice or if you're not happy with the plan? Do they have a vested interest in you liking it, you keeping it, you being happy with the decision, or are you just out on your own? Fortunately, I just had this happen last month where a person was recommended a plan from a volunteer, and it didn't cover the doctor or the hospital that he wanted to use. But it was cheap, didn't even cover for prescription drugs. So he was going to have a penalty, had to go through a bunch of hoops to get it fixed for him. But that was a problem that he shouldn't have had to have. So again, Mike Lovell, founder of AskMedicareMike.com. My phone number 608-571-4461. Been a licensed agent since 2009. I'm an independent broker, represent a bunch of different companies, but I work for you. Give me a call today, see if I can help you.